My particular specialty is head and neck surgery. And head and neck surgery basically involves everything between the brain above and the collarbones and the lungs below. So we treat benign and malignant tumors of the sinuses, mouth, tongue, throat, neck, thyroid, trachea, voice box. Head and neck cancers are relatively uncommon, comparing it to something like breast cancer, colon cancer, lung cancer. Head and neck cancers are probably 1/5 to 1/10 as common as those cancers, which is probably the main particular reason why you need a specialist. Nobody sees a gazillion of these. And so you need someone who sees a lot of these uncommon cancers because of their practice, interests, or expertise. The surgical robot allows you to get into tight spaces with what's called minimally invasive surgery. If I have to get in and take care of a tumor of the throat, I've got to get instruments in there in ways that I can see in there in that tight, dark space very efficiently. Historically, we used to make large incisions through the neck. We used to divide the jawbone to spread it apart to get our hands in there. And we figured out with technology, we could work just through a patient's mouth, get the same view, do the same surgery, and get out without having to do big incisions. They could go home tomorrow versus go home in 3 weeks. I wouldn't have been able to develop practice and expertise and knowledge with that instrument if I didn't have an institution that was willing to invest in that technology, because ultimately they knew we would figure out a use for it that would be better for the patient. You can only do narrow margin surgery if you have the help of a pathologist who's very good at reading that pathology and saying, Dr. Moore, that's normal tissue, you're around that tumor, or no, that's tumor tissue, even though it looks normal to your eye, you need to go further. As you come to see me as a patient, we don't work on a formula. We want to know who you are. We want to know what you do day to day. We want to know what's important to you, what of your senses, your throat, your tongue, your speech, your swallowing is really critical to you in your daily life and value. Who are your family members? What's important to you in your life? And that may be totally different for you than it is for the next person who walks in with exactly the same kind of pathology.